If you're a non-traditional student or a student looking to apply to DO schools, go check out the Old Premeds podcast over at oldpremeds.org. The episode that went live this week talks about the new changes to the ACOMAS, which is the application service that you use to apply to DO schools. The episode talks about the changes that will occur in the 2017 application cycle, getting rid of their grade replacement policy. Again, that's oldpremeds.org. This is the Specialty Stories, session number 5. Whether you're a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you will want to practice. This podcast will tell you the stories of specialists from every field to give you the information you need to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome back to the Specialty Stories. If this is not your first time here, if this is, welcome for the first time. My name is Dr. Ryan Gray, and I host several podcasts here on the MedEd Media Network, including this podcast, Specialty Stories, the Old Premeds podcast, which I mentioned earlier, talking about the changes to the ACOMAS application policy. I also host the Pre-Med Years and the MCAT podcast. So if you're new to the podcasting world, go check out everything we do over at mededmedia.com. This week, I'm excited to have an orthopedic hand surgeon on the podcast to talk about hand surgery and orthopedics in general.
My name is Raghu Mupavarapu. I'm an orthopedic hand surgeon.
And are you in an academic or a community-based setting?
I am in a sort of a hybrid setup. I'm in a community-based hospital and program, but I do have residents who I interact with who come rotate through this hospital, but they are not orthopedic residents. They're surgery and medicine residents.
Okay. How long have you been practicing?
I'll be finishing up 2 years in a few months.
Okay. When did you know you wanted to be an orthopedic surgeon, and I guess on top of that, a hand surgeon?
Orthopedic surgery, I think I decided sometime towards the end of my second year of med school. I really enjoyed the experience I had during my second year 1 week elective, and I enjoyed talking to the orthopedic residents and the field in general, and anatomy and that kind of stuff. And then I chose hand surgery towards the middle of my orthopedic residency, kind of during my second/third year of orthopedic residency, because I'd done my rotation on hand surgery for 3 months with some very well-known and very smart hand surgeons who like to teach. So I kind of had a very good experience, and I liked the intricate nature of the hand, but I also like the fact that you got to do every kind of major thing in orthopedics, which was working with the bone, working with the muscles, working with the tendons, working with the nerves. And people usually really rely on their hands, and they were very happy when we helped them and made them feel better.
What do you think led you to orthopedics versus general surgery or any other surgical specialty, if that's what you were considering?
For me specifically with the orthopedics, I enjoyed the aspect of it, which was that it allowed me to focus on kind of the extremities, which is what orthopedics is mostly about. And it was a specialty which had multiple subspecialties, meaning I knew you could do sports, you could do joint replacements, you could do shoulder, you could do the knee, you could do hand, you could do children. And so it gave me a lot of options once I went into it. And I also liked the fact that you were kind of a specialist. General surgery, in my mind, has become very much like a primary care field, where you kind of are the person who has to deal with everything that happens in the abdomen. And sometimes as a general surgeon, I felt like the service, when I was as a med student, I felt like the general surgery service was almost like a medicine GI service. There was really no cross correlation for orthopedics, where if it was an orthopedic problem, orthopedics dealt with it. If it was not an orthopedic problem, then they didn't deal with it.
Were there any other specialties out there that were in the running?
Yes, definitely. So kind of in the beginning couple years of med school, the things I thought were interesting, the things I liked were orthopedics. I also liked anesthesia just because it was something in the OR where you got to do procedures and you got to do things and kind of help people put them to sleep, that kind of business. I also liked radiology, similar to orthopedics because it had to do with muscles and imaging and anatomy and that kind of stuff, which I thought was something useful because you look at it, it's very kind of straightforward because you're just interpreting an image, but you are the person who's kind of the specialist interpreting it, so that was interesting to me. And I did like the interventional aspect of radiology where you could go do some of the procedures and stuff. I also liked ENT. It was another field similar to orthopedics and hand surgery where it's a surgical specialty. You're doing a lot of kind of intricate stuff, but you are working with various different organs, including bone, skin, soft tissue, nerves, and all that kind of stuff. And once again, you get to work with adults and children, which I thought was a interesting thing. But those were kind of the four that I considered during those first few years.
What traits do you think lead to being a good orthopedic surgeon?
Which traits? That one's a good question. It's a kind of I'll kind of start with the generic things that I guess we used to look for in residency, and also things that I went through when I was in med school. But obviously, just like any specialty, the simple, easy things are: you want to be someone who's a hard worker. You want to be someone who's dedicated and interested in your field. But going into like kind of the more not generic things, in general, if you're someone who likes working with your hands and kind of doing procedures, then orthopedics is something that's usually an interesting thing and it's something that will interest you. If you don't like kind of getting your hands dirty and doing things procedural-wise and stuff like that, then orthopedics may not be the ideal thing for you, or even surgery in general. The other thing about orthopedics is most of the orthopedic surgeons, everyone's like, oh, you guys like sports. You don't have to like sports to like orthopedics. I know plenty of good orthopedic surgeons who have absolutely no interest in sports, but they have interest in other things that some people would consider similar to sports, which are they like working with wood, so they do woodworking in their spare time. They like playing musical instruments, like the piano or the saxophone and stuff like that, which involves having good coordination with your hands and your eyes and your brain. So those are all things that I thought were useful and helpful in orthopedics.
Describe a typical day for you.
A typical day for me, if it's an office day, I usually get to work around 7:30, and my office starts at around 8, and I see approximately 20 patients between 8 a.m. and 4 p.m. with a half-hour break for lunch. And then if it's and that's for that day, and then in between I may get some consults from the floor and some calls from patients and things like that, which I have to answer and take care of. And each patient I spend about 20 minutes with in the office, and then I'm about 5 minutes doing my charting. And on a surgery day, usually surgery starts at 7:30, so I get to the hospital around 7. I do anywhere from 3 to 6 surgeries a day, depending on the type of surgery and the length of surgery, and I'm usually done by around 3 or 4. And then usually once a week I take call on the weekends, and then one weekend a month of call.
So you're a hand specialist, at having specialized with a fellowship in hand surgery. What
Correct.
Percentage of your surgeries are specific to your subspecialty?
So my original training was orthopedics, and I did a hand subspecialty. So I would say approximately 75 to 80% of my surgeries that I currently do are hand upper extremity surgeries. And what I mean by that is hand, wrist, forearm, elbow.
Is that common to only have 75 or 80% of your subspecialty as part of your surgery, or is that just part of your practice? Can other people do 100%? Yeah,
so that's a great question. It's just what my practice is set up as, because I enjoy doing the general orthopedics, and I like doing fracture care and taking care of some of the other problems that some of my patients come in, which is such as knee pain, shoulder pain, ankle pain, things like that. But there are, I would say, the majority of hand surgeons do only hand surgery, meaning they're closer to 90 to 95% of their work is hand surgery or upper extremity surgery. And then they may have about a 5% kind of random stuff they do because of things that happen when they're on call, where the emergency department calls them about someone who has a hip fracture or an ankle fracture, and then they take care of those things as well.
For your hand practice, what types of patients are you seeing? What sort of problems are you treating?
It's a very wide spectrum, and this is another reason why I liked hand surgery and also why I liked orthopedics, because there was a wide spectrum of things people would come in with which you were able to treat. So for me, I would start off with the most common things are things like carpal tunnel syndrome or cubital tunnel syndrome, which is basically compression of the nerves in your hand and upper extremity. I also see a lot of tendinitis, so that's things like trigger finger, where your finger gets stuck in a bent position, or tendinitis of your wrist, which is called decurvains, which is a fancy name, but it's just a tendinitis involving your wrist. There's also tendinitis at the elbow, such as golfer's elbow or tennis elbow. So the other things I see are a lot of hand fractures or hand injuries, such as traumatic injuries. Fracture-wise, I see people punching walls or other people and breaking their knuckles. I also see people slipping and falling and having injuries to their hands and wrists and elbows that way. And then I see a lot of traumatic injury in the sense of lacerations to the hand. So people getting cut with a knife or a sharp object which they break in their sink, maybe when they're washing dishes or something, or people using power tools such as saws and drills and things of that nature. I see a lot of that, and so I'm often in the emergency room in the midday or midnight fixing someone's fingertip which is barely hanging on and things of that nature.
What percentage of patients that you see in the office do you end up taking to the operating room?
Actually, a very small number. Most people think if you're a surgeon, you're going to spend most of your time taking people to the operating room. That's actually a falsehood. I see 20 people a day in the office, and that I would say probably is on the low end of the spectrum. But I probably, from that 20 people, take 1 to 2 people out of that group who I will book for surgery.
Do you feel you have good work-life balance as an orthopedic surgeon?
Yes, I do. I think I have a great work-life balance. I'm married, and I get to spend a fair amount of time with my wife, and we do travel at least once every 3 to 4 months to go on a vacation, and we enjoy our time together. I also have a number of hobbies outside of work, including sports such as basketball and golf. I also like to I read, which I get to do plenty of time with that as well. And I do get to spend time with other friends and family besides obviously just my wife. So I think it's a good mixture, and I think you will have a good chance of having a say in how you want to set up your life if you're a surgeon, because you get to pick and choose what you think is important to you.
I didn't ask it before, but you talked about surgery days and office days. What is a typical breakdown? What does your schedule look like as far as that?
My schedule, I'd say, is pretty typical, which is 3 days of office and 1.5 days of surgery, and then a half day, which is kind of flexible, where I either do paperwork or administrative work, or I have the option of doing extra surgery if something comes in that needs to go to the operating room in a more emergent fashion.
What makes a competitive applicant for orthopedics?
A competitive applicant for orthopedics, so if you, as a med student, is someone you want to be involved and active in orthopedics and show an interest in orthopedics. So someone who you don't need to decide when you're first year of medical school, but as soon as you decide in your second or third year, you want to go talk to the orthopedic department at wherever your school is and just get to know some people in the department and mention your interests and maybe get involved in some sort of research or going to some of the lectures on their conference days or things of that nature. Obviously, scores are very important. That's kind of the first step that gets you into the interview or the door, which is getting a good score on your boards, your USMLEs. I think nowadays is kind of the score that most people look for, something above 230 on the test. the kind of the other things that they look for is getting good letters of recommendation and getting good scores on your clinical rotations. Especially the rotations that involve surgical stuff. So things such as your surgery rotation, your OB rotation, which is a surgery affiliated, and to a certain extent your medicine rotation, because it's usually a big rotation where you spend a lot of time on, where you are taking care of sicker patients and potentially spending some time in the ICU and things like that. So kind of those three things. You good scores on your USMLEs, good scores on your away rotations, and then showing an interest in orthopedics with some sort of research or getting to know somebody in the department. Therefore, you can get a good letter of recommendation because they know you for more than just this 3 weeks or 4 weeks you do your rotation.
Have you seen any bias in the orthopedic field towards DO applicants?
I think in the past there used to be some bias in regards to this, where potentially DO applicants were not getting what some people thought was the proper kind of consideration. But I think in more recent years, DO applicants are starting to get more recognition as being just as competent as MD applicants. But if you look, I guess, below the surface, there probably is a slight bias against DO applicants applying to MD orthopedic programs.
What is residency like as an orthopod?
Residency as an orthopedic surgeon it's tough. It's like any surgical residency. You spend a lot of time in the hospital. You get to know your classmates or the people from the same year as you very well. And every year it gets better because that's just how surgery residency is. Your first year, your intern year is usually your worst. And then each year after that, it gets better and better and better, and you take less call and do less time in the hospital, but you have more responsibility in the sense that you have to monitor the classes below you, make sure that they're not doing anything wrong. But I enjoyed it a lot. I learned a lot, and I was glad I did it when I look back upon it. Would I have wished that it was a little bit easier and I didn't have to spend as much time in the hospital? Yes, but I'm still glad I did it.
Now, are all orthopedic residencies the same length?
Yes, they are. They're pretty standardized. You do 1 year of what we call general surgery intern year, but it's usually at the place where you're going to be doing your orthopedic residency. And usually half of that year, 6 months of it, you spend doing orthopedics, and then 6 months you spend doing general surgery, with the potential for a 1 month in there of doing an elective such as radiology, which is useful for orthopedics. And then you do 4 years of orthopedic-only residency at that institution.
And then for hand surgery, what does that fellowship look like?
So all the orthopedic fellowships are actually 1 year. So hand or shoulder or knee or anything you do in orthopedics, it's all a 1 year fellowship. There are some folks who like to do 2 years, so they do a second year in a different fellowship. So maybe you want to do shoulder and hand and elbow. So you'll do a hand fellowship, and then you'll go do a separate shoulder fellowship. And that way you can say that you do everything from the shoulder to the fingertips.
How competitive is a hand fellowship?
The fellowships for orthopedics are cyclically competitive. And what I mean by that is every 4 to 5 years, there's a new popular fellowship that everybody wants to go into because that's what there's the big name people are doing, or that's what everyone suddenly gets interested in. So for the past 4 to 5 years, hand surgery has been that popular fellowship for orthopedics, partly because of the nice lifestyle you could have, and also partly because of the fact that your longevity is better in hand surgery because you're not doing the more physically demanding surgery such as knee replacements or hip replacements. But currently the trend is cycling to sports medicine or sports orthopedic surgery, and that's become the more competitive one in orthopedics. But I would say in general, if you want to do a fellowship in orthopedics, you can get a spot in a fellowship of your choosing. The question is, can you get a spot in the city or location where you want? And that depends on if that fellowship is competitive at that time, which is, as I said, it's cyclical. Every 5 years, there's a new fellowship that becomes popular.
Something that popped up when you talked about longevity. Talk about women orthopedic surgeons. There's, I think, a preconceived notion that an orthopod needs to be a big burly man. Talk about your experience working with women orthopedic surgeons and the opportunities for females to enter orthopedics.
Yeah, this is a great question. I've had the fortune of actually working very closely with multiple female orthopedic surgeons. We had numerous female orthopedic surgeons in my residency program who trained us, and they were in different specialties, including sports, common joint replacement, hand surgery, shoulder surgery. So they did everything, and so we got to learn from all of them. And then I had also the benefit of having multiple female orthopedic residents in my residency program, including a classmate of mine who I thought was very competent, and I personally thought she was a better resident than I was, because she was smart, she was very hardworking, and she had excellent hand and eye coordination and did very well in the operating room. But I think there's no people who think that women can't be orthopedic surgeons are very foolish, and I think that women can be just as good as men in orthopedic surgery, and they can do any of the specialties that they want in orthopedic surgery, because it's just a matter of knowledge and training, and it's not a matter of your size or, I guess, personality. So I think there are more and more women going into orthopedics, and then there's more and more women in orthopedics doing fellowships in the various types of orthopedic fellowships.
What do the boards look like?
The orthopedic boards are, in a sense, similar to the USMLEs, but it's focused only on orthopedics. It's a multiple choice question. You have a part 1 and a part 2. So part 1 is a 300 question multiple choice exam broken up into sections of 50, and it's a one-day test, and they ask you questions ranging from simple things such as biology and anatomy, such as how do cells differentiate, what anatomical structure is in this part of the body, things of that nature, and then they ask you things as complicated as what surgery specifically would you do for a specific orthopedic condition, and they may even ask you the exact implant or type of structure you would create to fix that problem. So it's a test that not only tests your knowledge of basics and anatomy and physiology and kind of the biology of the bone, but also your knowledge of orthopedic surgery and how to make a broken bone or another type of pathology better. And that's part 1. And then the part 2 is an oral board where once you are out in practice, you submit 6 months worth of your surgery. So 6 months worth of your surgical cases, you would have to submit them, and they will review all of those cases, and they will pick a certain number of those cases that you then go and discuss with senior orthopedic surgeons who have been in practice for 10 to 15 years, and they will ask you numerous questions, including why you did the surgery, what was your thought process, and they will judge if you are a competent surgeon who is making good clinical decisions and taking care of patients, or if you're someone who's abusing your power and perhaps doing the wrong thing and injuring patients instead of helping them.
Do you have any idea what pass rates are for the boards?
I do. So for part 1 of the orthopedic boards, if you're a U.S. medical graduate from a U.S. orthopedic residency, your pass rate is in the low 90% range. And for part 2, it's very similar. It's also in the low 90% range, somewhere around 92, 93%.
Looking back and knowing what you know now, what do you wish you knew before starting your orthopedic residency?
I guess I wish I'd known the time passes by much quicker than you think. And there's numerous times in residency where you have the opportunity to perhaps go spend a little bit more time at work, but get a valuable learning experience. And I'd say half the time, most of us will choose to go get that little extra learning because we have the energy and the time and willing to do it. But the other half the time, you're just so run down and beat up. You're tired. You just say, forget it, I'm going to go home. And you miss out on a learning opportunity. And I wish someone had told me ahead of time that those opportunities don't come about again once you finish your training. And what I mean by that is, now that I'm an attending surgeon, I can't go and just observe someone doing something willy-nilly in the middle of my day, because I have my own patients to see and my own surgeries to do. So for me to do that, I have to take a day off. I have to get permission to go to see another surgeon in another hospital, and it's a big deal. But in residency, the whole goal is to see and learn as much as you can. And so I wish someone had given me that one piece of advice earlier in my residency. I figured it out by the time I was a senior resident, and I took every opportunity to learn everything I could at that point. The other thing I wish someone had told me is that you have to go in prepared those first 2 to 3 years of residency to miss important life events that such as friends' weddings or birthday parties and things like that, and not feel bad about it, because it's what you're giving up to achieve your goal and your dream. And once you finish those first 2 or 3 years of residency, things will be easier, and you will be able to go to everything you want to do and enjoy your life and things of that nature.
What do you wish primary care physicians knew about orthopedics?
I wish they know that we are capable physicians, and we do understand some medicine. We're not all just bone jockeys who are dumb and pound our fists against our chest and drill into things. We are people who went to med school as well, and we did well in med school, and we understand kind of the anatomy and physiology of the human body. So I definitely would appreciate if more of them would give us some credibility in regards to that. And the other thing would be if primary care physicians would take a little bit of initiative on their own part to learn the musculoskeletal exam, or at least the basics of it, so that they can actually examine their patients and be able to direct them appropriately to the orthopedic surgeon, instead of just sending them to us without ever having actually seen the patient, just because they complain of ankle pain or finger pain or shoulder pain or whatever it may be.
What other specialties do you work the closest with?
I would say the number one specialty that I talk to the most is the emergency room physician or the emergency room physician's assistant, because they are the ones that I talk to on the phone whenever they have a question or they want to let me know about a patient that they think needs to be seen by me. Followed by them, the next most likely specialty is the internal medicine team that's in the hospital. So a patient gets admitted and for whatever reason, and then they have maybe a fall, or they complain after a day that, oh, my wrist is hurting, or my hand is swollen, or my ankle is hurting, or whatnot. So those are the two people who on a day-to-day basis I talk to a lot. And then the other two that I talk to on a slightly lesser basis, maybe once a week, is rheumatology and neurology. Rheumatology because they deal with arthritis and inflammatory disorders such as gout, and neurology because they deal with the nerves, and the nerves are often things that get compressed or involved when someone has a bone injury or an orthopedic type condition.
Are there any special opportunities outside of clinical medicine for orthopedics?
I'm not very versed on that. I do know that there are some physicians, orthopedic surgeons, who are involved in the development of orthopedic implants and orthopedic products, such as bone cement and antibiotic-related orthopedic implants, and the knee replacements and hip replacements and trauma plates and screws and things like that. I personally have not been involved in any of those things, but I do know other doctors are involved in what we call the R&D, or research and development, of these products and tools.
What do you like the most about being an orthopedic surgeon?
I like being able to see people in the office and talk to them and interact with them, and be able to give them an answer to the problem that's been plaguing them for months or years, and then be able to give them a solution for the problem. Which is something I do every day. Someone comes in to see me with something as simple as carpal tunnel, and they don't know why their fingers are numb and tingly, and why they wake up in the middle of the night with their hand feeling dead to them. And I examine them. I'm able to tell them what carpal tunnel is. I educate them. I give them an answer to their diagnosis, and then I provide them with a treatment, which 95% of the time, usually the treatment is able to cure their problem. And so I get the satisfaction of interacting with other human beings in a positive way and helping them as well as curing them of their problem.
On the flip side, what do you like the least?
The least is probably two things. One would be, I guess, being on call, meaning getting a phone call at 2 in the morning and having to deal with something that's an emergency. I don't think anybody likes that. Doesn't matter what specialty you're in. No one wants to get called at 2 in the morning when they're sleeping and woken up. And then the other thing would be the few patients that I'm not able to help. The people that come in with a problem that has been going on for so long or is so bad that they are beyond my ability to help. And those are the things I don't like.
How much call do you have to take?
The average orthopedic surgeon probably takes 5 to 6 days of call a month. So that ends up being effectively you take 1 weekday a week and then 1 weekend for the whole month. And that ends up giving you your 5 to 6 days. They are orthopedic surgeons who take no call, just because that's how they set up their practice or their work schedule. And there are orthopedic surgeons who take a lot more call because they want the extra patient volume and the extra work and money and all those sort of things.
If you had to do it all over again, would you choose the same specialty and subspecialty?
Yes, I would definitely choose to follow this path if I had to do it over again. And I would say with confidence, I would definitely go into orthopedic surgery, and I would say with confidence that I would most likely choose hand surgery again. And the reason I say most likely is because I liked orthopedics, and that's why I chose to go into orthopedics. And I chose hand surgery as a specialty not because I liked it more than orthopedics, but because I liked it equally. And there were a few other specialties in orthopedics that I liked as well, which I didn't necessarily choose because I felt like my training in them was adequate through my residency.
What do you see as the future of orthopedic surgery?
I do think orthopedics and in general medicine will both change over the next 15 to 20 years. At some point, we will figure out ways to heal the body and improve things without surgical intervention. And what I mean by that is we'll figure out a way to do lasers or use nanobots or whatever those things are to make the human body better, which doesn't involve us cutting someone open and putting metal inside them. But things that are happening in a more immediate future for orthopedics is that we have improved our ability to fix people's broken bones by making smaller incisions and using sturdier implants that are less likely to fail and break. We've also gotten better with the biologics of bone. So when people have injuries to their bone, we have figured out how to stimulate the bone properly so that it heals faster and stronger. We've also figured out how to treat tendinitis and injuries to muscles and tendons without having to traumatize them with surgery, by instead doing things like injections or using stem cells or platelet-rich plasma and things of that nature. So all those things are helping. And then the final thing, which is something that's going on across all parts of the world in all jobs, is robots and robotics. And we are also using those things to help us and help our patients.
Any last words of wisdom for the pre-med or medical student that's interested in orthopedic surgery?
Don't be daunted or scared by the competitiveness of orthopedics. It's not as bad as people make it out to be to get in. Just decide what you want to do and go for it. And don't decide on orthopedic surgery for the money or the fame or the popularity or just because it's what everyone else is doing. Look inside yourself and decide if that is what's going to make you happy, because at the end of the day, you want to pick whatever specialty you can be doing and be happy doing 15, 20 years down the line, because that's what's going to keep you going to work every day, and that's what's going to keep you happy with your work and home life, and that will, in the end, give you the most success.
All right, so there you go. If you are interested in orthopedics or hand surgery or any of the other subspecialties, I hope that was a good interview for you. I am looking forward to having more orthopedic subspecialists on to talk about why they chose the subspecialties that they ended up choosing and what they think about orthopedics as a career. I hope you got a ton of great information out of the podcast. Again, go check out everything we're doing at MedEd Media. And if you did like this podcast, I would love for you to leave a rating and review in iTunes. Just pop open iTunes, type in specialty stories, and leave a rating and review. It takes just a minute, and it means a lot for us. Have a great week, and we'll catch you next week, hopefully, here at the Specialty Stories and MedEd Media.